Hello, welcome to the Innovation Summit in Resilience and Preparedness 2021. I'm Dr. David Alexander, Senior Science Advisor for Resilience at the U.S. Department of Homeland Security. I work in the DHS Science and Technology Directorate, where our mission is to bring cutting-edge science and technology to the Homeland Security enterprise, enabling innovative solutions to our frontline missions, supporting border and maritime security, cyber and critical infrastructure protection, immigration and customs enforcement, emergency management and disaster resilience, and state and local first responders. To put that in perspective, when we think about Homeland Security, we mean first responders, TSA agents, infrastructure operators, FEMA disaster teams, and all the men and women who work every day to keep our community safe and secure. When we think about S&T, we mean the R&D, testing, evaluation, piloting, and transition of innovation to our stakeholders. It's a pleasure to being with you to kick off InSPIRE 2021. This event is near and dear to my heart as one of the principal founders. And I'm pleased that the many partners of DHS were able to join the National Alliance for Public Safety GIS, NABSIG, in supporting this year's event. While things are a bit different with the challenges the nation is still facing and experiencing from COVID-19, we all will miss the in-person engagement. NABSIG and InSPIRE 2021 and the principals have worked very hard to bring you a rich, very interactive, and compelling agenda for this year's summit. I would like to thank NABSIG, Peter O'Rourke, Tricia Lawson, and Angela Purville for inviting me to speak and for leading the organization of this year's event. InSPIRE plays an important role in bringing key stakeholders together from across public safety, infrastructure operators, industry, and the research communities. I wanted to take a few minutes to share some observations from the 60,000-foot level on the larger science and technology and influencing factors and thrust areas that are impacting the resilience community. Themes that are well represented here at InSPIRE. Resilience and preparedness is a fundamental mission of the department that extends well beyond traditional hazards and threats, as illustrated by the current COVID-19 pandemic, by the latest civil unrest, and the exacerbating issues of disinformation. During these challenging times, the DHS mission has not changed, but it has been amplified by the COVID-19 pandemic and other emergencies. And we might dare to say that state and locals and our other partners are experiencing similar circumstances. DHS and its operating components, including S&T, are engaged like never before. And S&T is playing and continues to play a pivotal role. A few trends we have observed around science and technology are continued convergence between an acceleration in the pace of science and technology innovation and an increase in the velocity, uncertainty, ambiguity, veracity, and scale of social, technological, and environmental challenges we face. We're also witnessing more engagement with individuals and civic groups that are action-focused, and most importantly, the surgency of the private sector and its role and capabilities that suggest some reimagining of the relationship between the public and private sectors, particularly related to data, analytics, and technology. These trends underscore a need to contemplate new strategies, approaches, and operating models that intersect the public, private, not-for-profit, and research sectors, and that require a whole community approach. Themes that have traditionally and continue to be an important part of the InSPIRE agenda. DHS S&T as the research arm for the Homeland Security enterprise is uniquely positioned to conduct R&D into these needs. For DHS, this means ensuring confidence, trust, and integrity in what we do, what we know, and how we act. Pursuing more interdisciplinary, interagency collaboration, more cross-cutting research across institutions, more streamlining of R&D cooperation between the public and private sector, more cooperative research and development agreements, more cooperation with nonprofits, state and local, tribal, and territorial equities, and international communities. It's not just about advancing the science for us, as well as we see the same in the InSPIRE community. It's about developing the technology or spurring new industries. It's also about preparing the workforce and growing the next generation of practitioners and innovators so that America can continue to thrive in our interconnected and complex world. Safety, security, prosperity, and well-being are not unique to the DHS mission. They are human-centered goals encompassing multiple community dimensions. Understanding the advances, enablers, and drivers of opportunities and risk requires understanding space and our place in context toward achieving resilience. DHS S&T, like other organizations, are working across our partners and sectors to deliver timely and actionable science and technology to key stakeholders, to address some of their major challenges, technical gaps, and operational needs. Given the evolving threat landscape and the pace of innovation, I believe it is vitally important for us as a public safety and emergency management community to better understand disaster resilience and the intersection between societal dimensions and science and technology. Dimensions such as public safety and security, economic stability and resilience, health and well-being, community identity and social connectedness, improving trust in science and government, and addressing global risks such as climate change. We need to strive towards solutions that are strengthening the resilience of these cross-cutting enablers such as education, employment, infrastructure, institutions, systems, and in more simple terms, here's what I mean. Advancing resilience, equity, and support for vulnerable and disadvantaged populations, piloting solutions and approaches that address the co-occurrence of disasters and compound events, exploring the technology and workforce of the future to strengthen our economic resilience, conducting new foundational and observational research and data that can cultivate the next generation of innovations, developing new technologies that are green, eco-friendly, and help us build back better, assessing the scalability and transferability of solutions to other communities and stakeholders to lessen social and economic disruption, and ensuring these innovations are equitable, available to all, and that no community is left behind. So welcome to InSPIRE 2021. Thank you for participating in this year's summit, and I look forward to virtually engaging and learning from all of you.
Welcome to the annual NAPSG Foundation InSPIRE Summit. My name is Peter O'Rourke, Executive Director of NAPSG Foundation. Thank you for taking the time to be with us today. Before we jump into InSPIRE's content, we thought it might be useful to provide a brief look back as to what NAPSG has been up to over the past year. And by NAPSG, I don't just mean the direct NAPSG team members. I mean all of you, our community, both our technical and operational community members, as well as our partners at DHS, FEMA, and so many other agencies. As always, the backbone of NAPSG Foundation is our training and education efforts. Each year, we conduct 2 virtual training series, one called Prep Tech Talks, the other EMGeo Forums. The EMGeo Forums are conducted in partnership with our friends at FEMA Response Geospatial Office. Topics in those sessions last year included everything from innovative public information to social vulnerability indices to FEMA community lifelines and many, many more. Between these 2 training series, we have trained thousands of public safety officials, both here in the United States and around the globe, all at no cost to them. All of those trainings are available on our website for download. I will briefly touch on some additional work from 2020. A big focus in 2020 was on standardizing information for decision makers, first responders, and the public. For example, we have been developing search and rescue and first response tools focused on field data collection. Since 2019, over 50 different SAR teams have used these templates and tools to train, exercise, and respond to disasters, and they have been adopted by FEMA USAR. Also, NAPSG and our community have partnered with GIS Core and Cedar Digital to harness the power of crowdsourcing using our crowdsourced photo map. Understanding the initial impacts of a disaster can be very challenging, especially without geographic context. This platform focuses on quickly finding, mapping, cataloging, and sharing the location of damaged photos found in news stories and social media platforms. We've had over 500,000 total views of our crowdsourced map, something we're very proud of. We're also working with GIS Core and Cedar to provide critical information to the public through our wildfire early notification map. The goal is to quickly map the location of reported fires and provide links to authoritative information in order to increase situational awareness. It does not replace authoritative information, but is indeed intended to help fill critical gaps. We've had over 10 million views to date, and a big thank you to our dear friend and former colleague, Paul Doherty, for all his efforts. To access these and other resources, please visit our website, napsgfoundation.org. You all have seen the agenda for these 3 days. While it is streamlined compared to previous years, I know you will find the information incredibly useful and topical. In addition, all of the live sessions, as well as the pre-recorded on-demand sessions, are going to be available on our website for download all year. For those of you who missed our InSPIRE 2019, I can't believe it's been over a year since we all got together in person, but for those of you who missed our InSPIRE 2019 at Galveston, Texas A&M Galveston, we put together this wonderful video for you. And with that, an official welcome to InSPIRE 2021. We are so pleased and honored that you'll be spending the next 3 days with us. As you can see, we have over 500 registrants for this event. Over 50% are from state and local government, and we have a terrific mix of discipline. The goal of this summit has long been to bring together a healthy mix of state, local, tribal, federal, and other perspectives and experiences. We learn from each other, from our successes and from our setbacks, and from simply engaging with each other. And to that end, I want to make sure I acknowledge the contributions of so many in putting the summit together. Foremost, I will always acknowledge and thank Dr. David Alexander, without whom the concept of the summit would not have come about. David is an incredibly important part of our thought leadership universe. And on behalf of NAPSG Foundation and our community, thank you, David. I also want to thank our many partner organizations who are listed here. They are key contributors not only to the summit, but to all of the work NAPSG Foundation does. And a very big thank you to our platinum and gold sponsors, without whom we would not be able to hold this event virtually or in person. Unlike so many other sponsored events, our sponsors ask for so little return for donating their hard-earned money. So thank you for your support and for your belief in our shared mission. Last but never least, the NAPSG team that I am so fortunate to be a part of. You work so hard and with such passion to create a summit that is valuable, practical, and inspiring. Thank you. I look forward to seeing all of our participants next year in person, and please never hesitate to reach out to me if NAPSG Foundation can be of assistance to you. I would like to kick off our first disaster innovation talk by introducing Dr. Ted Smith of University of Louisville School of Medicine, where he is the director of the Center for Healthy Air, Water, and Soil.
I'm delighted to share with you today some work that we're very excited about from the University of Louisville, and work that I think is relevant to this gathering and I think to the overall emergency management and disaster response and recovery, as well as the broader healthcare industry. And that is wastewater-based epidemiology. And the title of the talk today is People, Places, and Pipes. And I think that's really the way that I've come to think about this category that most people had never heard of until the COVID pandemic. And now it's a platform that I think it's going to take all of us to realize its full potential. So just to give some context, as a researcher at a medical school, I'll be approaching this topic of GIS from a health geography, health risk perspective. And what I wanted to share with you is, let's call it a case study that we have developed in response to this COVID pandemic. And so at the beginning of the pandemic, we realized that testing of people was a real limiter. So the availability of clinical tests, diagnostic tests was just awful, as I think all of us can recall. And we were saving tests for healthcare workers. Then we were saving tests only for the very sickest, people that were presenting symptoms overtly. And that meant for many, many, many months, maybe the first 4 months of the pandemic, we really had no idea how prevalent COVID was in communities across the country. Again, because our test supplies were so limited that we couldn't test a representative group of citizens. And so we found ourselves in a position where we were more or less flying blind about the true extent of this risk. And again, this is a case study. This is one risk. And I'll end our talk today with many, many, many other things that really do function just like this. But for the purposes of our case, so we didn't have enough tests. And many groups around the world that had experience sampling for pathogens in sanitary sewers and in latrine pits in developing countries and in other settings where there was sewage available, they had developed methods that could essentially find these viral particles in the sewage. And so early on, we worked with our city county. Louisville is a merged city county, Jefferson County, Kentucky. And we essentially reached an agreement that we would try to do something different. We would try to balance the county's needs for doing clinical testing of people with very scarce test kits available, balance that with broad monitoring of wastewater across our community. And so we became one of 3 legs of a stool for testing for Louisville, Jefferson County. One was for the healthcare workers. We were reserving tests for healthcare workers. A second group was for the very symptomatic sick. And then the third was this broad surveillance. And so what we did is we divided our county up into stratified areas. So Jefferson County, Louisville, Kentucky has, like many communities across the country, very different characteristics socio-demographically across the area. And so in order to do representative testing, we needed to understand how the different parts of our geography reflected themselves. And so if we were going to make a statement about a particular group of people being more vulnerable or being more likely to be infected, it was important for us to have that GIS kind of a frame. And so what we did is we first divided up the county into these areas. Then second, we worked with a contract research organization called Westat, who works with the CDC for many, many other large cohort studies across the country. And we worked with them to figure out a way to randomly test people with nasal swabs by sending them mailer invitations in those distinct sections of Jefferson County. And this nice map that shows you these distinct areas. And so we knew we could do random sampling of the public that would help us then compare whatever we got out of the wastewater to some known reference point. And so we stratified the county using, the traditional variables. If you're used to political polling or any kind of sampling methodology like that, you know that you want to have equal numbers of males and females. You want to have the proportionate numbers of Blacks and whites, and you want to have socioeconomics sort of sorted out so that when you actually get a sample, you're able to say confidently, I have a representative data point from a group, and I can generalize to that group. So fast forwarding, we simultaneously tested over 8 months the population with nasal swabs and the sewers in catchment areas that mapped to those sampling areas. I'm going to tell you about the sewers in a second, but let me tell you about the testing of the people and the location of the people. What we found in various waves, and you can see our most recent wave on the slide, is that the amount of infection varies greatly across the community, and it does change over time. And so this geography, what is the reason that some places have higher infection levels than others, becomes an important question. It becomes an important question for public health. It becomes an important question for the kinds of response that one might take. Now, this particular testing that we did was twofold. We did active infection, which people are used to. So do you currently have the COVID virus infecting you? And then a second test, a high-end antibody test, which would then help us understand whether you've ever been infected by COVID. And so I can show you here, you see how the rates of infection have been largely underreported across the country, and certainly here in Louisville, because when you were just testing symptomatic people or people that could get to a test, you were undercounting all sorts of people who never showed symptoms, didn't realize they were infectious, people who weren't able to get to a test. And so the antibody tests for us were a nice way to get a complete picture of the prevalence of infection. And so you can see, if you look at the bottom axis, what our county health department reported were the number of people that were infected cumulatively to that point in time. And then we look at antibodies, we see that there's another 100%, another 80% that were missed by that methodology. And then, of course, if we go look at active infections over time, you can see that our random sample has followed the same pattern that we see with the other clinical testing. We saw a surge, into the November-December timeframe that we're currently resolving right now. So that's a lot of discussion about human testing, and we make the case that the best way to understand a pathogen, an infectious disease at the community level is to do this randomized testing of the public. And that testing is very expensive. And yes, to our knowledge, we're the only community that put that much effort into essentially surveillance of the levels of infection. And as a country, we certainly need to know about the infection everywhere. And so really, this was the driver to essentially try to move to a conversation that, again, was a health geography conversation. It was, what do we know about where the people are? So the people and the places in a community. And then, is there any other kind of a platform that can answer the question, how are people doing? And so welcome to the pipes. And so for the pipes, I really mean the connected sanitary sewer systems that are really all over the country, and virtually every community with 10,000 or more people will have some sort of centralized wastewater treatment facility. Certainly the majority of the population in the United States is served by a sanitary sewer system. And so the reason we would want to explore that is, of course, because it's passive, right? So I don't need to go find all of those people, because it is sort of comprehensive or equitable. So meaning, everybody within a metropolitan area is going to be served. And so we're not going to miss anyone, which is certainly a problem with lots of other clinical paradigms. And we're able to do it on a repeated basis with real economies of scale. So, that the effort to get one sample is then only incremental to get the second sample and the third sample and the fourth sample. That's actually not true for other kinds of testing of people. The cost to get the first sample is the same the second time you get the sample, is the same the third time you get the sample. So once we can have access to an infrastructure that is just regularly passively producing samples, the incremental cost goes down over time. And so these are lots of good reasons that we might want to take a look in the sewers. Well, the other thing that was pretty important during the pandemic was Yale, some researchers at Yale published some remarkable findings that showed that when they looked in the wastewater systems in New Haven, Connecticut, they were able to detect increasing levels of SARS-CoV-2 virus, the virus that causes COVID, a week before people would present in the hospital. And so that became famously the idea of an early indicator, that if you were in the wastewater system, you would be catching the infection earlier than any other source could. And so that became a big driver, for the field for the COVID surveillance. I'll remind everybody that the way this actually works from a medical perspective or clinical perspective, is that when you are infected, one pathway of infection is through the GI tract, and you end up shedding the virus through feces into the sewer system. Some of that is coming from infection along the lining of the GI tract. Some of that is coming from swallowing mucus or other inhaled particles that may be going down and leaving your body through feces, and that ends up in the wastewater system. And then we are able to use the same technologies that we use with nasal swabs to extract the RNA from the virus. Very quickly, just a quick tutorial, the way that you pull this stuff out of the sewers varies greatly. So everything from grab samples, where you're literally putting a little bucket in the inside a manhole and pulling a sample out, to more representative auto samplers that get installed that pull a sample every 15 minutes for 24 hours, all the way up to wastewater treatment plants where there are samplers built in for environmental monitoring. So you can see here, we've divided our city also then according to sewer sheds, and these would be zones that map to those demographics so that we would be able to compare our clinical results with our wastewater results. So what we have found, just to cut to the chase, is we quite reliably track with our own county health department statistics, and we very reliably track with our randomized sampling. I'll show you here just where areas light up from our random sampling and how we've seen those same areas light up from the wastewater. And then there are some areas that we know that have equity issues, where we've been able to see wastewater results where the clinical samples, because of low participation, we never had seen tested results. So again, one for health equity. Then maybe one of the big ahas is it's comforting to see the overall trend, a rise in infections that we know about, a resolving of infections on the other side. And then, of course, the same thing in the wastewater, a rise in the virus particles in the wastewater, a decline in the virus over the same period of time, right? But we found some things that we think are really important that speak to what the future is for this field, and that is what you find at the level of a wastewater treatment plant, which may serve hundreds of thousands or millions of households, depending on your city, is actually different than what you find out in the neighborhoods that contribute to those wastewater treatment plants. And so I show here a slide that you can see there is a level of virus that is much, much higher in an area that is primarily African American and was not represented well in the testing that was done. And so it's an important area in our community to understand because there's so much health risk. And then that was lost. The signal that we saw there was lost by the time it got to the wastewater treatment plant. It got averaged out. And so we think this is a really important opportunity to bring this geography of the pipes into the conversation about what is a effective health monitoring network using this kind of critical infrastructure. I'll just sort of close out the COVID talk with, we have recently been able to identify some of these variants of concern and variants of interest by the CDC using this very same methodology. So we've moved from counting the virus to sequencing the virus that we find, because as I think we all know, a successful resolution of this pandemic is making sure that we don't let this virus escape the vaccine shield that we've put in place. So it's good to see the tool move with the public health challenge. So because many of you are used to looking at GIS maps, I thought we would share a couple of GIS maps. So it's one thing to think about how our people have settled the Louisville area. It's another thing to look here at this slide, which is the sewer network of Jefferson County, or the next slide, a deep dive into a neighborhood. And once you really get close to this infrastructure, you see that it was really designed to remove waste away from households as quickly as possible. And it really didn't matter, kind of in what direction as it was going, as long as it was following gravity. So you can see here, the arrows go in all different directions, depending on which part of our county you're in and which neighborhoods you're in. And so this was not a system that was designed to simply walk in and say, oh, the sampling point for this neighborhood will be the far northwest corner, and it will always be there and it will serve this group of people. This is an infrastructure that just wasn't designed for people to be out in the network. It was an infrastructure that was designed for monitoring at the treatment plant level. So it is my hope that with a larger professional community, we'll begin to see that the limitations of this infrastructure are limitations of protecting our health. And so we need to first start with an understanding, city by city, what this infrastructure looks like. Not only total coverage, but really the way that it's laid out, the access points that are available. Are they convenient? Do they make it possible? Is there power? Is there any kind of basic telemetrics? And so these are fundamental questions that really must be answered and then must be addressed before this is really a high utility tool for us. And so I'll just remind everybody that beyond COVID, the tremendous opportunity here is looking at health as broadly as possible. So infectious diseases is certainly one category, and there's a tremendous number and variety of infectious diseases that put all of our populations at risk all of the time. And to have a regular program that's looking at these pathogens is truly a tremendous opportunity. But in addition to infectious diseases, those pathogens, those viruses, the bacteria that we may be concerned about, there's a whole nother collection of attributes that we can learn. So toxins. I think many in emergency management are very attuned to the idea that we need to protect populations from accidents, from acts of domestic terrorism, anything that could produce a toxin that could affect an area, a population, and certainly anything that could spread beyond an initial area. And so this infrastructure is absolutely perfectly suited for that kind of surveillance, detecting the presence of a new toxin, quantifying the amount of that toxin, and then comparing it to known clinical risk associated with that toxin. So the whole area of toxins, we've just started the work here in Louisville looking at air toxics, so looking at volatile organic compounds. And we have been able to isolate urinary metabolites of those. And so we understand in a certain collection of neighborhoods how much exposure there are to these dangerous VOCs. And you can only imagine if we can find a whole panel of VOCs, we can certainly find a whole bunch of other toxins that are really critical to know about for protecting the public. And then beyond that, we have this great opportunity, and I have a slide here from Arizona State University and the work they've done out at Tempe, looking at prescription and non-prescription medications, which of course are also available through the sewer system. And so to get an understanding of really the health status, if you will, not of an individual, but of an anonymized group of individuals, a place where we can begin to develop a new understanding of the health status and the health risks in different parts of our country. The value, of course, in that is that we know that more than 90% of non-communicable diseases, those chronic diseases that we talked about before we had a pandemic, so that's heart disease, that's diabetes, that's depression, all of these high burden diseases for our public really have roots in environmental circumstances. So these are not genetic conditions that individuals are born with. These are conditions that arise due to environmental circumstances that individuals and communities are in. And so the great frontier, and really I'll close with this, is we think there is a tremendous opportunity to use an infrastructure like this, using smart health geography as our guide, to begin to develop interventions, assessments and interventions at the community level to protect health, to prevent the development of these diseases. And I think we could all agree, moving from a concern about an acute, immediate risk to living in a healthier way, in designing cities in a way that puts health first, that protects vulnerable communities because we learn about problems sooner, or that we validate best practices for better urban design. All of these things are, I think, uniquely propelled by developing this wastewater monitoring infrastructure. And I know it's going to take all of us, and I'm delighted to be part of this community. And I look forward to seeing what we all come up with next. Thank you so much.
Thank you to Dr. Smith. Our next speaker is Daniel Stoelb, the GIS coordinator for the Oregon Office of Emergency Management.
All right, good morning, everyone. Hi, I'm Daniel Stoelb. I'm the GIS program coordinator at the Oregon Office of Emergency Management, and I'd like to talk with you all about our wildfire response that we had this last year. Obviously, it was a very major event for us, to where we had pretty much a slow start to the fire season this last year. And right around Labor Day, of course, things ended up kicking off for us, to where we had multiple fires that were ignited, and then further caused downstream issues due to a very rare high wind event, to include 50 to 60 mile per hour gusts coming from an easterly wind, which ended up causing some pretty significant issues with wildfires expanding over into the western portion of Oregon. there were over 1 million acres burned as a part of this event, which is twice the 10-year average for our state. There were at least 500,000 Oregonians under an evacuation, whether that's a level 1, get ready, get set, and get go, with more than 40,000 people having to evacuate their homes as a part of this event. As you can see on the graphic here, I'm just going to show a quick little video. And this is indicating all of the fog in addition to the fire smoke that occurred throughout the state for this particular event. As you can see, a lot of impacts with the little red dots indicating where the active fires were burning. There were parts of the state to include pretty much the entire state that were covered by smoke as a part of this event. You notice that as those fires expanded, the entire western portion of Oregon was engulfed by smoke to later encompass the entire state. As I mentioned earlier, we had over 1 million acres that were burned as a part of this event, with the two major fires being the Lion's Head, Beachy Creek, Holiday Farm, and Riverside fires. One of the bigger issues that we had as a part of this too was the air quality. Granted, everyone was already wearing a mask due to the COVID event, and this only made things worse to include several areas of the state that had a hazardous air quality rating. And you could actually smell it within our emergency coordination center. It was that bad. I have kind of a fun little graphic there describing, in Lord of the Rings terms, how bad was it? Well, most of the state was under a Mordor air quality index. And this is as of September 14th, 2020. Couple of days post-fire activity, the winds caused the issues, which then caused the dense smoke throughout most of the state there. Some of the images that were depicted from this particular event included multiple communities that were completely wiped out due to this, to include walls of smoke coming over the Cascades, which splits the western half of Oregon from the eastern half of Oregon. Some communities, like I said, just absolutely obliterated from this event. One of the major fires occurred in southern Oregon with the Alameda fire, and that wiped out over 2,000 structures as a part of that event. So one of the big things that we've been doing for these events has been involving and integrating GIS in operations in our planning section. So a lot of the stuff that we've been doing, we've slowly been building upon prior successes to advance a lot of the projects and programs that we wanted to institute as a part of sharing geospatial data and coordination of information for situational awareness. One of the big solutions that we had over the last few years has been a statewide fire evacuation layer. Back in 2017, so this resulted from the solar eclipse that we had a few years back, we wanted to be able to track statewide fire evacuations and equip our local agencies and tribal entities and state partners with the ability to view, access, and update that information as necessary. During this event, we had multiple counties that were impacted as a part of it, to include 8 declared counties for fire management assistance grants and active ongoing operations. We had GIS staff from across the state be able to go in and update a master fire evacuation layer to depict what was going on for evacuations. One of the big things that we did as a part of this event was coordination of those GIS providers to keep in contact with them, ensure that they had access to be able to update those services, provide support as necessary, but also kind of had this peer-to-peer relationship to where those counties that did not have a local GIS person with the ability to update those boundaries, they were able to borrow from another county to be able to provide for GIS support. So some counties were able to help take care of other counties, which was a huge success and really provided kind of a great network of people to be able to work together and provide for situational awareness statewide. One of the other big advancements that we had as a part of this program was to be able to provide some additional analytics to indicate how many people were being evacuated. Now, previously we had this 911 section that kind of had their own GIS sets of data that they were maintaining to include address points, street center lines, boundaries, et cetera. And emergency management kind of had its own little box here. This was actually the first event where we combined forces and actually used and utilized that 911 address point data to do population estimates. So taking a look at the boundaries that were drawn by our local GIS data providers and be able to supply some brief analytics to indicate the estimated populations that were impacted by these wildfires. So for example, here's a screenshot showing the number of addresses and estimated populations in each of those evacuation levels. So we took the 911 address point data, overlaid that with the wildfire evacuation boundaries, and did a quick estimate of, okay, 2.59 people per address as an estimated housing factor for across the state, results in a net of, at this point in time, over 28,000 people impacted by wildfire. To further kind of expand upon that concept, we were also taking snapshots of that GIS data over time so that we could have a timeline indicating, you know, what were the impacts over time to help provide for additional information. So this little dashboard that we have here is indicating the estimated population in evacuation statewide over time. We also had this broken down by counties as well to really show kind of the timeline of events to say, okay, well, at this point in time, you know, there were over 127,000 people in a level 3 evacuation on the 10th of September. So kind of a neat way for us to be able to integrate a couple of different sets of data to really provide for an adequate sense of situational awareness for what was happening in our state at that point in time. One of the big things that we had as a part of this event was damage assessment information. Now, I will say that this was a very unique event in that we did get an individual assistance declaration prior to damage assessment data being gathered. It was very quick to run up the chain to be able to provide for that degree of assistance, but we still needed to have access to that damage assessment information for awareness purposes, but also to be able to share that information with our partners, because as we transition from response to recovery, damage assessment provides a key and critical role there. There were lots of agencies that were involved in collecting damage assessment information, such as the Oregon State Fire Marshal, FEMA Urban Search and Rescue. FEMA contracted with NGA to do geospatial damage assessments for the Alameda fire. American Red Cross was going out doing their assessments, and counties had done their assessments as well. So you see the little chart there indicating, you know, all of the different counties, so 8 counties in total, there were 8 different sets of data. And those kind of varied over time to determine what the authoritative set of data was. Now, at the start, what was the information that we got on very quickly? That was the initial authoritative source. And then as those reports slowly started to come in from each of those counties, each of those jurisdictions, we were able to then update the authoritative source for that particular jurisdiction. First ones on the scene were Oregon State Fire Marshal. They went out and did assessments. FEMA Urban Search and Rescue was very early on in doing their assessments as well. So being able to kind of reconcile those different data sets to come up with the number. Everyone wanted to know, what is this number? You know, what is the number of destroyed homes for those jurisdictions? But one of the great things that was that came from this event is all of this data was gathered in a GIS format. Previously, it was typically like an Excel spreadsheet or a form that was filled out, but this was the first event to where we actually saw different sets of GIS data being provided as a part of that. Now, going with everything else here, dashboards were key to our elements of response here. Based upon, you know, what information we were looking for, we were able to develop a dashboard that indicated the steps in the process. You know, what did things look like? What were the damage assessments looking like as they were coming in? What were the sheltering operations looking like? How many people were being sheltered? How many animals were being sheltered? So we equipped like our Oregon Department of Agriculture with the ability to go in and update a GIS service that painted the picture for how many animals were being sheltered at locations across the state. I already demonstrated the wildfire evacuation estimates over time. We also, as FEMA was doing the individual assistance applications, we were able to pull down that data set, be able to indicate how many people were registering for assistance and how much funding was being provided to local communities to recover. Same case for tracking data as far as mission assignments from state agencies to fulfill requests for assistance from our local and tribal partners. Now, how many requests were being submitted into the system? Where were they at in the process? What were the updates to the missions that were being assigned out there? As well as, you know, what missions were not actioned on in a reasonable time period so that we could follow up on those outstanding missions. So a lot of stuff that was going on. Some of it was coming from data sources that were in the GIS format. We were also taking information from our Op Center crisis management application, which I'm sure many of you are familiar with systems like WebEOC, but it's a SQL database on the back end. And we were able to convert that information into a nice graphic dashboard to indicate, you know, what was going on as far as requests for assistance and mission assignments for our state agency partners. But being able to take all of those bits and pieces of information and providing a consistent way that we showed data, you're able to walk the map, but be able to show relevant information in a story map. So we used the story map series template to be able to walk through each of these different dashboards to provide relevant details for incident briefings, for update meetings, et cetera. Probably the biggest product that we produced as a part of this event was our wildfire response and recovery overview page. So this is utilizing Experience Builder, and I'm sure many of you probably saw the Esri user conference last year where they demonstrated the Esri Living Atlas of the World indicators template. This is taking advantage of that particular platform, that template, and we configured it based upon our needs. So in talking with our planning section chief and our public information officers, we identified, okay, these are the key critical sets of information that we want to be able to show and indicate. And based upon that, taking that data, formatting it for public display, and categorizing that information into individual buckets, then really shows you, okay, these are the cards of information that we want to display first and foremost. It's like a dashboard of indicators that we're showing here, but being able to click on each of those individual cards to provide for relevant details about that particular thing. So if I take a look here, going to our Experience Builder site here, see a lot of information pertaining to ongoing recovery operations. So we have some reference data from the response that's still relevant, but also combining that with a lot of impetus about what does the recovery look like? How are things recovering from these particular events? So if we're dealing with information about what are the ongoing sheltering operations, what do they look like? Clicking on that will then bring me to this page here that shows the direct housing mission information and what is showing up for the disaster housing program. So how many people are approved for housing? How many are currently licensed in? So those are people with keys in hand to be able to get in. And then the number over time. So being able to take information, and actually this is a survey 123 form on the back end. That data is then contributed to a centralized layer on the back end. We're then able to visualize that in a nice, easy to read and understand format through a dashboard. And also, you know, we talk about the housing mission and then transitioning over to non-congregate sheltering. and showing informational details about what does the ongoing non-congregate sheltering. So these are people that are housed in hotels still, and how many people are in those, how many within each county, and then the daily population over time. So as it stands right now, almost 1,300 people are still being sheltered in hotels from this particular event. You can tell that our recovery operations are going to be going on for quite a long time. So it's a great way through these types of visuals, these dashboards, experience builder products, to be able to provide relevant information for particular topic areas. So it's the concept of 3 clicks to content. If I navigate to a page, what are the main things that I want to see first and foremost? And then based upon that, I can click to get more additional details about that particular item of interest. So lots and lots of stuff that we've built as a part of this. It took a long time for us to build, but the great news about this is we've developed our own template off of this information. So moving forward for future events, we have a great example to refer back to. So one of the big things for us has been, okay, we're managing a lot of content, a lot of information, and all of a sudden everything goes high order very quickly. I'm sure a lot of you are familiar with event starts small, then gets very big very quickly. For us, we're not used to that. GIS it started with kind of the throw the map up on the wall to, okay, we're managing a little bit of information here, to now there's a lot of information, a lot of people that need to know that information. And we need to be able to provide for adequate and additional support here. So we utilize the Emergency Management Assistance Compact to be able to pull in people from outside to assist us during this event. This was the first time that we utilized EMAC to provide for GIS support. A lot of it was, the ArcGIS Online content management, adding people to groups, developing survey forms, dashboards, and coordination. Now, I love this image of Chris Farley here because it is pretty much the perfect indicator that, yeah, it's been a year of historical events. Things tended to build upon each other. But one of the big things that we took away from this was, lots of work to go around when you're requesting EMAC support. We want to be able to provide the adequate set of what we need so that when we get that resource in, we're able to match that to what our needs are. It's almost like writing a position description where we're indicating, okay, these are the key things that we need, and here's kind of our list of nice to haves. Working really well with our EMAC coordinator to be able to be notified of offers that were being submitted. Once those offers were accepted, we actually got on a quick little Zoom meeting to talk with the 2 individuals that came out to assist us. And we utilized Trello for tracking all of our projects and assignments. So it was very easy to grant them access into our Trello board so that they could then see, and we were able to have this little Zoom meeting and walk through all of the assignments that we had. It included also some reference information, so a contacts list that talked about who all was there doing GIS coordination at the local level, and really just providing our EMAC folks with the running start that they needed so that when they showed up to our office, they were able to hit the ground running. So it was really, really worthwhile for us to be able to pull in. We doubled our staff, basically, and be able to have that sharing of idea, thoughts, and considerations for not just our state, but also their home jurisdiction. So big thanks to Walter and Joni that helped out there. So some big initiatives moving forward. Our damage assessment project. I mentioned earlier, 8 different counties, 8 different sets of data. We want to be able to have a consistent format moving forward. So having a standardized template through Survey 123, utilizing Hub to be able to have people come into a central location, to sign in, pull down the content, show the QR codes, be able to review and update their information. Really is going to be great for us to have kind of a consolidated, consistent method for being able to collect that content. Obviously, improving on processes that we have for coordination of data. So being able to provide for consistent calls talking about where we're at in the process, but also being able to organize content effectively. So some of the major takeaways. Number one, don't host your private data or your private server data on a public facing site. It will go viral. Trust me, it happened to us. We transitioned over to using ArcGIS Online for our wildfire evacuation layer. We were getting 1 million hits a day in one day on our public facing content. Don't be afraid to ask for help. Many hands make light work. That's a phrase that I like to use. Sam is telling us share the load. We really want to be able to do that, because the more you have individual responsible agencies maintaining data, the better it is. We don't want to be so far removed from the response there. We want to have those content creators and responsible agencies take care of their own data. We're not the authoritative source, they are. So what can we do to be able to equip them with the tools to succeed? Work with your public information officers. One does not simply create public content. They are going to know really what folks out there need to know. A lot of times the public information officers are involved with higher level executives like the governor's office and legislators to help paint that picture. Working with our PIOs, we're able to then take that information, package it in a way that's easy to read and understand. Keep in mind, your legislators and executives are not going to sign into ArcGIS Online to view stuff. They want something to where they click on a link and they get presented with the information that they want and need. And they want it fast, right? It's always, we want it yesterday. So some final thoughts on this. Really, I mentioned earlier, our GIS degree of response started with okay, we're going to throw a map up on the wall and there's our GIS thing. Now it's it's a very different environment. Solutions have changed over time to where you're more configuring stuff as opposed to creating and programming your own special thing. And what that's enabled us to do is really focus on, man, how do we organize our content in a way that's easily found, discoverable, and displayed in a way that makes sense? The people that are out there that are really primarily using these tools are not GIS specialists. They are people that need to know information and need to know it very quickly. A lot of the stuff that we had for public facing content, 1 million hits a day. News agencies were utilizing our public facing applications to inform the public about what was happening within their jurisdiction. The big thing for us was, how do we get it to a way that the average person can go to a particular site and see what's happening, specifically for their home? One of the big things that I'll kind of leave you guys with is, my folks were actually evacuated from this particular event. They were evacuated from their home. Fortunately, it wasn't burned. And I got a call during emergency operations from them saying, help, we need help. How can we get safely to your house? And based upon the information that we had, as far as the fire evacuations were concerned, routes that were open and closed, I was able to direct them with a route to be able to safely make it to my house so that they could be sheltered effectively. Keep in mind, disasters affect everybody, not just those of us that are working the response, but those out there in the public. And what can we do to be able to provide them with information that they need to see to show what's happening, but also our response partners and how they are able to take a look at all of the information that's being provided to them and be able to make those effective decisions to move forward. You know, some big things here. Engage with your relevant points of contact. Make sure that they are coordinated with so that they know and understand what's happening. And build upon your successes from your last events and share them. Now, emergency management, we're not our unique little unicorn out here in Oregon. Many other states deal with similar issues, and being able to participate in events like this, the InSPIRE conference and others, be able to have this platform to share our experiences and knowledge with one another really helps us to be a better prepared for nation. You know, we're all a community here, and you know, we may have unique disasters out here. However, the response, the organization of content, identification of essential elements of information, we're all dealing with the same thing out there. It's just maybe a slightly unique flavor for our state versus other states. So thank you very much for allowing me to talk for the Disaster Innovation Talk for the InSPIRE Conference. I'm more than happy. If you have any questions for me, feel free to send me an email. I'm also active on LinkedIn and Twitter. Feel free to send me a message. I'm more than happy to talk with you guys further. Thank you so much, and enjoy the rest of the conference. Thank you.
Thank you, Daniel. And a very big thank you to our Platinum and Gold sponsors, without whom we would not be able to hold this event.